In less than a month, cholera, a deadly waterborne disease, has reached nearly all of Syria's governorates and infected more than 10,000 people, according to UNICEF. And millions of people living in makeshift camps across the country's war-torn north are increasingly at risk.
Everybody is scared of this disease. It is very dangerous. Last winter, disease spread and many people died. We have to take some preventative measures.
Clean water and basic sanitation can prevent cholera outbreaks, and the disease is treatable. Untreated, however, it can kill within hours. By Thursday, the death toll had climbed to at least 39. The Syrian Ministry of Health says most of the deaths involved patients who had delayed treatment or had chronic, pre-existing conditions. UNICEF says that war, energy shortages, and drought have left nearly half of all Syrians reliant on alternative and often unsafe water sources. The agency says much of the nation's water infrastructure has been destroyed, and most of its sewage is left untreated. Here in Idlib province, the last part of Syria still at war with the government, cholera cases have not been as widespread, but residents and aid workers say an outbreak in this war-torn area could quickly grow out of control.
Most unplanned camps do not have a sewage network, and there's nothing we can do to provide a healthy environment for the residents.
Roughly half the 4 million residents of Idlib are essentially homeless, living in crowded camps for displaced families. Most people here rely on humanitarian aid for their basic needs. The United Nations has called the outbreak a serious threat to Syria and the region, and has called for swift international action.
The
international community knows that epidemics like this spread in conflict zones and can kill large numbers of people. There should be special assistance in the fields of water and sanitation, and later in establishing cholera treatment centres.
The World Health Organization says that cholera cases worldwide have surged this year, with 26 countries reporting outbreaks. Experts say, besides war and climate change, cholera, like many deadly diseases, is inextricably linked to extreme poverty. For Munib Taim in Idlib, Syria, Heather Murdoch, VOA News.